अभी नहीं आई है।
Good morning. Can I start?
Someone stuck up in the traffic.
At the outset, I would like to thank AIOS for the opportunity to present this paper. There are nil financial disclosures. To start with, to look at the management of keratoconus, in the early cases where the thickness is adequate, the options include collagen cross-linking or a combination with ICRS or PRK where contact lens intolerance is there. But in advanced cases where the corneal thickness does not allow collagen cross-linking, patients are usually subjected to contact lens for visual rehabilitation, and when they are contact lens intolerant, they await keratoplasty. Recently, there has been some exploration in the field of volume addition techniques to improve outcomes in patients who have advanced keratoconus and not suitable for collagen cross-linking. However, this is limited by global shortage of donor corneas, and recently in the pandemic, it was also seen that the procurement of the human transplant tissues was difficult. So this prompted some unanswered questions. What is the role of intrastromal implants and how helpful are they in advanced keratoconus that is not suitable for collagen cross-linking? And secondly, what are the visual and topographic outcomes of xenogenic implants in advanced keratoconus cases? So the aim of the current study was to assess the outcomes of intrastromal implantation of porcine collagen lenticules in subjects with keratoconus that are not suitable for collagen cross-linking. This was a prospective open-label clinical trial, and a sample size of 8 was sufficient to achieve the endpoints. Descriptive statistics was used to analyze the results. Patients of more than 18 years of age with advanced keratoconus but a corneal thickness of more than 350 microns and who were contact lens intolerant were included in the study. And patients with previous ocular surgeries, corneal scars, poor ocular surface, a corneal thickness of less than 350 microns, and pregnant and lactating mothers were excluded from this study. All the patients underwent a slit lamp evaluation, corneal topography, in vivo confocal microscopy to look for changes around the implant, and corneal OCT at preoperative and every postoperative visit. So looking at the porcine collagen implant, it's called Xenia, which is a lenticule derived from anterior corneal stroma of the porcine cornea. It undergoes a 4-step process of decellularization, washing, compression, and then cross-linked with ultraviolet radiation to make it biomechanically stiffer. It is then around 90 to 100 microns thick after the compression, and it is around 7 to 8 millimeter diameter, available as a disc. So how the surgery is done is a femtosecond laser-assisted stromal pocket is created, and the Xenia lenticule is inserted into the pocket using a McPherson forceps or an injector, and then the lenticule is unfolded and centered in the pocket. Coming to the results, in all the postoperative visits, all the patients maintained a healthy interface, and there was a significant improvement in uncorrected and best-corrected visual acuity. In the OCT pictures, we could see that the lenticule was well placed in the anterior stroma, and there was a significant increase in the thickness at 1-year follow-up. When we look at the corneal topographic results, there was a significant flattening which was seen at 6 months as well as 1 year. In the in vivo confocal microscopy, changes were seen in the form of dendritic cell densities in the anterior as well as posterior interface. Within the lenticule, there was no stromal keratocytes or any inflammatory response, nor was there any subbasal nerve plexus infiltration in the lenticule. And these were the dendritic cells and activated keratocytes in the posterior interface. Looking at the summary of the results, the uncorrected as well as the best corrected visual acuity improved at 6 months as well as 1 year. There was a significant keratometric flattening seen at 6 months as well as 1 year. Improved corneal thickness was seen, and the anterior corneal astigmatism showed a significant improvement. There was no significant improvement in the posterior corneal astigmatism, which could be due to the fact that the stromal implant was placed in the anterior part of the stroma. In the confocal microscopic changes, we saw that the dendritic cell density was significantly increased only up to 6 months of the surgery, but it came down to normal at 1 year, and the keratocyte density was insignificantly changed. Now, stromal keratophakia is known for treatments of myopia, aphakia, as well as hyperopia, because it changes the corneal curvature, and that is the mechanism that is used to correct the refractive error in those cases. Recently, stromal lenticule implantation has been explored in advanced keratoconus, which is not suitable for collagen cross-linking as well. But this global survey in 2012 was conducted, which showed that almost 50% of the patients in the world who require a corneal transplant tissue do not have one, and there is one cornea available for at least 70 needed. which prompts everyone to think about whether there is an alternate for human corneal transplant and to look at xenogenic transplants. So why looking at porcine collagen is because it is anatomically and physiologically more similar to human cornea. More so that recently it has been confirmed that it also has a Bowman's layer similar to human cornea. So xenial lenticule is a porcine collagen lenticule that is derived from anterior corneal stroma, undergoing decellularization to wash off all the keratocytes and the antigenic epitopes, then washing and compression to reduce the thickness, and finally cross-linking. A study has shown that they are 50% thinner than the original tissue procured, and at least 120% higher biomechanical stiffness is achieved. So we found that xenia had the advantages of being less complex as compared to keratoplasty, can be done under topical anesthesia without any sutures. It reduces the risk of rejection because there are no antigenic epitopes, and there is a faster procedure outpatient. And it is a reversible technique as compared to keratoplasties. So to conclude, the study concluded that porcine collagen implants can successfully improve the visual outcomes in patients who are not suitable for collagen cross-linking. They can flatten the corneal curvature, add volume to the already thinned out cornea. There is reduced risk of rejection, and it can be seen as a novel alternative technique for volume replacement in cases with thin corneas not suitable for collagen cross-linking. Thank you.
How long was your follow-up, Rashmi?
1 year.
1 year.
This is the 1 year results, ma'am.
Okay, so there was no extrusion or anything like that?
One patient we had explanted because they were not able to maintain follow-ups. So at 3 months only that patient was explanted.
Okay, and how the interface? Because any tissue you put inside has 2 layers of interface. So did you do any aberrometry or any eye trace or something like that
No,
to see the
only
interface?
The confocal microscopic and topographic changes that we have looked at in this study. I showed the images of the anterior as well as the posterior interface by confocal microscopy. So the keratocyte density has not changed over time. The dendritic cell density was changing, initially showing more inflammatory response, but it came down after 6 months. So till 6 months of time, the dendritic cell density was significantly higher, but at 1 year it became insignificant.
But how was the clarity of vision? You can say the line acuity may be there, but how was the clarity?
So we have also done low contrast visual acuity, and that also was significantly improved. In the interest of time, I have not included that data in the paper.
And how many lines of improvement did you find?
We found 1.5 to 2 lines of improvement when it came to low contrast
BCVA or
visual
UCVA?
acuity. This is BCVA that I'm talking about, ma'am.
And did they need contact lenses or something like that?
Sorry?
Did they need contact lenses fitting
no,
after
so
that?
patients who were contact lens intolerant were taken in the study.
And
Because if
after
they are
you put
suitable
it,
for contact
how much
lenses-
did the thickness increase?
So thickness increase I have shown it improved from 354 to 387 in the 6 months according to the study, and in the final visit also it was around 389. So around 30 to 40 microns increase, which shows statistical significance.
And what was the thickness of your lenticule?
90 to 100 microns.
And did it compress itself? Did it absorb? What happened
So
to
the
it?
fact that it was not a 1+1 equation when it came to pachymetry improvement, because the pachymetry improvement was 40 to 50 microns, we thought that there might be some amount of stromal compaction or the lenticule compaction after it was inserted. But of course, we have a 1 year follow-up only.
And you cross-linked it or it came
It
cross-linked?
came cross-linked. It was a suggestion given.
So there was around 50% decrease in the thickness at 1 year. What thickness was implanted? Approximately. So you implanted a 90 micron thickness lenticule, and there was increase of around 35 micron. So that was significant compaction. Normally we see around 20 to 30% compaction of any human lenticule that if we use, but it was much more than that.
True. But also that it acts like a splint almost, because it's quite a stiff thing when you put it inside as compared to when we insert a smile lenticule or a donor-derived, human corneal donor-derived lenticule. It is a little stiff when you are inserting it.
Which femtosecond you used?
Wave light, sir.
Wave light.
Yeah,
okay.
yeah. There's an option of stromal pockets.
Okay. And there was interface haze as is seen in this at 1 year also. Significant haze is still visible in this. So this was this is one patient.
The visual axis was clear, sir.
Okay.
Okay. In the edges of the pocket, you might see a little bit of haze there, but the visual axis has remained clear. And that is why the visual acuity was also seen to be improved.
Okay.
But
Good
there was
stuff.
no significant scarring there in the center at least.
Thank you. Excellent.